So it all started about 30 years ago as a volunteer. Did a first aid course and encouraged to join up on the ambulances and on the side of the rugby fields. Did that for 10 years, and during that time became associated with the helicopter in a rescue setting, rappelling out and helping out as a paramedic, and then more and more involvement as my qualifications increased. Yeah, well, the opportunity to work on the helicopter was quite amazing as a paramedic. The first helicopter was a two-bladed Jet Ranger, and now we've got an amazing Sikorsky aircraft that has plenty of room, gets there fast and gets the people who need help. Well, lots of flights really, too numerous to count, but certainly to a lot of different types of incidents whether it's a medical or trauma, so lots of different things. So the helicopter itself would have saved thousands of lives by getting there quicker than a road ambulance and getting people to definitive care where they can be assessed and treated. With the start of the Northland Emergency Services Trust, that was a big partnership between St John and the Trust with crewing and funding, and so we've been really tight with that. It's a big team thing, so from the pilots through to the medics in the back and the people that financially support, the whole community is behind it, and as a St John paramedic, we're part of that and proud to be. I think there's a big sense of relief when they see or hear the helicopter coming. And most times they have the ambulances there, or be it at the hospital, and they're a really important link. But I think Northlanders really see the value in having a service like this, where we can get highly qualified personnel, whether the hospital or medics, to them, and with the thought of getting themselves to a major hospital or surgery in a really opportune, quick time, because minutes can make the difference too, from not only getting us to the scene to help out, but getting them to doctors and hospitals as well. As I say, there's been lots of jobs that we've been to, and some have been quite sad. We can get there and do our best to help people, and quite often that has really good outcomes, but sometimes it can be, we get there and because of the circumstances, there's really limited stuff that we can do, and some fatalities have occurred prior to us getting there. So dealing with kids can be a real challenge, especially for the medics who might have kids of the same age. We can relate to the pain that parents can be going through, and relate it to our own circumstance, which can be a challenge. But I think, in those circumstances, we dig deep, we deal with the situation and what we need to do, and try and work through the consequences of that later. I think the big thing in the role that we play is that we can make a difference. We're there to help, and we have skills that we can bring to the patients that we look after. And, numerous times we see an improvement in when we have them. We can do things to improve their situation, and then we can follow up patients later down the track, and you can, there's quite often they come back to the hangar or see us on the street, and you think, wow, we did make a difference. They have survived. They're still part of a family and part of the community. So it's good to make a difference, a positive difference.